First, recognize that documentation is your friend, and you need to work towards developing a technique that works for you, when you're comfortable with. Now, what should you record? You should record facts and observations, along with the date and the time that those observations are made. Here's where being knowledgeable in the clinical grading rubric will help you in making observations of student performance in the clinical setting. You want to also make sure that you're aware of the level of detail that the program officials are going to require to make sure that the message that you're trying to send is a message that they're getting properly at their end. You also want to make sure that you're sending these documents to the program office on a timely basis. Another area where you have legal responsibilities is in regards to student academic records. FERPA, the Family Education Rights and Privacy Act, is that law that maintains the right of confidentiality of student academic records. Now, recognize once again that you are seen as an agent of the academic program. You do have access to information that can get you in trouble, and information that you cannot share with others without written permission from the student.
And from your experience, what have you found has been the most meaningful documentation to present at a point in which there is a conflict that needs to be resolved between two parties?
I always recommend having what we call an employee contact record, or it can be called a student contact record, where you document those key conversations, more what is said than what actually happened. You do want to put just the facts, really stay to the facts, so that you can start building and looking at those trends versus the one-time behavior. When you're looking at trends, you're probably much more accurate and can address, again, the very specifics and lay out expectations that are very specific, so you have a much better chance of helping that student change behavior and get refocused in the right direction.
It's time once again to spend a few minutes with our panel of subject matter experts. One of the primary themes that we try to emphasize in this module was the importance of proper documentation and record keeping in the clinical environment. I'd like to ask each one of our panel members to give us an idea as far as the approach that's used in their program by their clinical instructors for documenting and recording student activities in the clinical setting. Let's first start with Nancy.
For our program, a few years ago, we went to an online or electronic clinical record, which is web-based. And in that, we were able to work more efficiently in getting records back and forth and sharing information about the student and what was happening. In that, we still have some paper products, but most of them are taken and placed in or transferred into the electronic record so that I can access it in my office as a clinical coordinator and make decisions or see what's happening with the student.
Great. I'm sure by going away from paper to an electronic format, it's really sped up the time in which the information gets back to the program office.
It does, and it made it so that we didn't have to use email anymore to send grades, and didn't have to worry about sending out the reminders in the same way. The timeline's on the electronic record. The clinical instructors go in and complete the documents, and then we have immediate access. So we've actually increased the ability or time frame in order to post grades for the student as well for their clinical rotations.
This concludes the sample of this module. Thank you for your interest in the Clinical Instructor Academy series.